Today we're comparing coffee and green tea head-to-head to determine which drink provides superior liver support. Not general health claims, not antioxidant buzzwords, specific advantages for liver enzyme reduction, fatty liver prevention, and protection against liver disease. The outcomes that actually matter for hepatic health. You've probably heard green tea is healthy. You might have heard coffee is bad for you. But when it comes to liver health specifically, which one actually delivers better protection? Right now, the score stands 0-0, but by the end of this video, you'll know the final score and the truth. This is the health verdict, where nature gets tested. Round 1. Active compounds and nutritional power. Coffee contains over 1,000 bioactive compounds, but the most important for liver health are caffeine, chlorogenic acids, and deuterpenes like caffeine and kawol. A typical cup of brewed coffee delivers 95 milligrams of caffeine and substantial chlorogenic acids, powerful antioxidants that reduce inflammation and oxidative stress. The deuterpenes have both beneficial and potentially harmful effects depending on preparation method. Filtered coffee removes most caffeine, which can raise cholesterol, while preserving beneficial compounds. Coffee provides minimal vitamins or minerals but delivers concentrated bioactive compounds that influence liver metabolism. Green tea contains catechins, particularly epigallocatechin galat, EGCG, the most potent and studied. A cup of green tea provides 50 to 100 milligrams of EGCG, along with other catechins that act as powerful antioxidants. Green tea delivers moderate caffeine, 30 to 50 milligrams per cup, providing some stimulation without coffee's intensity. It contains L-theanine, an amino acid that promotes calm focus. Green tea provides small amounts of vitamins C, E, and B vitamins, plus minerals like manganese and fluoride. Coffee delivers more caffeine and unique chlorogenic acids. Green tea provides superior catechin content, particularly EGCG. Both offer concentrated bioactive compounds with liver protective properties. This round is close, but green tea's EGCG has been studied more extensively for liver-specific benefits. The winner of this round is green tea. Current score: green tea 1, coffee 0. Round 2. Liver enzyme reduction. Coffee consumption is strongly associated with reduced liver enzymes, ALT, AST, and GGT, which indicate liver inflammation and damage. Multiple large population studies have found that people who drink coffee regularly have significantly lower liver enzyme levels than non-coffee drinkers. The effect is dose-dependent. More coffee correlates with lower enzymes, up to about 4 cups daily. Research shows that increasing coffee intake by 1 cup per day reduces ALT levels by measurable amounts. For people with fatty liver disease or hepatitis, coffee consumption is associated with slower disease progression and reduced fibrosis development. Green tea also reduces liver enzymes, though the evidence is less consistent than for coffee. Studies show that green tea catechins improve ALT and AST levels in people with non-alcoholic fatty liver disease. However, the effects are generally more modest than coffee's impact. Some studies show significant enzyme reduction, others show minimal effects. The variability may relate to catechin dosing. You'd need to drink multiple cups daily or use concentrated extracts to match the enzyme-lowering effects seen in studies. Coffee's robust, consistent evidence for liver enzyme reduction across multiple large studies gives it the advantage in this critical category. The winner of this round is coffee. Current score: tied, 1-1. Round 3. Fatty liver disease prevention. Coffee consumption dramatically reduces the risk of developing non-alcoholic fatty liver disease. Studies show that regular coffee drinkers have up to 40% lower risk of NAFLD compared to non-drinkers. The protective effect extends to preventing progression from simple fatty liver to more serious non-alcoholic steatohepatitis, NASH, which involves inflammation and liver damage. Research indicates that coffee consumption is associated with reduced liver fat accumulation, measured by imaging studies. The mechanisms include improved insulin sensitivity, reduced inflammation, enhanced fat metabolism, and antioxidant protection. Green tea shows promise for fatty liver but with less dramatic effects. Studies demonstrate that green tea catechins reduce liver fat in people with NAFLD, particularly when combined with exercise and dietary changes. The effect is measurable but generally requires high doses, equivalent to 4 to 6 cups daily or concentrated extracts. Green tea improves the metabolic factors that contribute to fatty liver: insulin resistance, inflammation, oxidative stress. But the clinical outcomes aren't as impressive as coffee's protective effects in population studies. Coffee's stronger protective effect against fatty liver development and progression gives it a clear advantage for this increasingly common condition. The winner of this round is coffee. Current score: coffee 2, green tea 1. Round 4. Liver cirrhosis and fibrosis protection. Coffee consumption is associated with dramatically reduced risk of liver cirrhosis, the severe scarring that represents end-stage liver disease. Meta-analyses show that each additional cup of coffee daily reduces cirrhosis risk by approximately 25%. People who drink 4 or more cups daily have up to 80% lower cirrhosis risk compared to non-drinkers. This protection applies to cirrhosis from multiple causes: alcohol, hepatitis, fatty liver. Coffee also slows fibrosis progression, the accumulation of scar tissue that precedes cirrhosis. The hepatoprotective effects are so strong that some hepatologists now recommend coffee to patients with chronic liver disease. Green tea shows protective effects against fibrosis, but less dramatic than coffee. Animal studies demonstrate that green tea catechins reduce liver fibrosis development. Human studies show more modest benefits. Green tea consumption is associated with reduced fibrosis markers, but the effect isn't as pronounced as coffee's. The anti-inflammatory and antioxidant properties of EGCG protect against the cellular damage that drives fibrosis, but clinical outcomes in human populations favor coffee. Coffee's exceptional protection against cirrhosis, one of the most serious liver outcomes, gives it a decisive advantage. The winner of this round is coffee. Current score: coffee 3, green tea 1. Round 5. Liver cancer prevention. Coffee consumption is associated with significantly reduced hepatocellular carcinoma risk, the most common form of liver cancer. Meta-analyses show that coffee drinkers have approximately 40% lower liver cancer risk compared to non-drinkers or minimal consumers. The protective effect is dose-dependent. More coffee provides greater protection. This matters enormously because liver cancer is often the endpoint of chronic liver disease. Coffee's ability to prevent cirrhosis likely contributes to cancer prevention, as most liver cancer develops in cirrhotic livers. Green tea also shows liver cancer protective effects in population studies, particularly in Asian populations where green tea consumption is traditional. Research indicates that regular green tea drinkers have reduced liver cancer risk, though the magnitude is generally less than coffee's protective effect. The catechin's antioxidant and anti-inflammatory properties protect against the cellular damage and chronic inflammation that drive cancer development. Some studies show stronger effects for green tea, particularly in populations with viral hepatitis. Both beverages protect against liver cancer, but coffee's more robust evidence across diverse populations gives it the edge. The winner of this round is coffee. Current score: coffee 4, green tea 1. Round 6. Overall health benefits and safety. Coffee provides cardiovascular benefits, reduced type 2 diabetes risk, enhanced cognitive function, and improved physical performance. However, excessive consumption causes jitteriness, anxiety, sleep disruption, and digestive issues for sensitive individuals. The high caffeine content isn't appropriate for everyone. People with anxiety disorders, heart arrhythmias, or caffeine sensitivity may need to avoid or limit coffee. Unfiltered coffee can raise cholesterol through cafestol. Coffee can worsen acid reflux and irritate the digestive tract. Green tea offers broader, gentler health benefits: cardiovascular protection, improved brain function, enhanced fat burning, reduced cancer risk across multiple organs. The moderate caffeine provides alertness without coffee's intensity. L-theanine promotes calm focus, counteracting caffeine's jittery effects. Green tea is gentler on the digestive system and rarely causes the side effects coffee does. It's appropriate for more people, including those sensitive to high caffeine. The broader antioxidant benefits extend beyond the liver to overall wellness. Green tea's superior tolerability, broader health benefits, and gentler effects make it the better choice for overall health, even if coffee edges ahead for liver-specific outcomes. The winner of this round is green tea. Current score: coffee 4, green tea 2. Round 7: accessibility and palatability. Coffee is universally loved by billions. The rich, complex flavor, satisfying warmth, and morning ritual make coffee genuinely enjoyable for most people. It's available everywhere: homes, offices, cafes, gas stations. Quality ranges from cheap instant to premium single origin, accommodating all budgets. Most people actively look forward to coffee, making daily consumption effortless. The taste alone ensures compliance. Green tea has a delicate, sometimes grassy or bitter flavor that's less universally appealing. Many people find it pleasant, but few crave it the way they crave coffee. It requires proper brewing. Water temperature and steeping time matter for optimal flavor and catechin extraction. Oversteeping creates bitterness. Green tea is widely available but not as ubiquitous as coffee. For many Western cultures, green tea feels like a health food rather than a pleasurable beverage. Coffee's superior taste and universal appeal make it the easier daily habit for most people. Consistency matters more than marginal superiority if you won't actually drink it. The winner of this round is coffee. Current score: coffee 5, green tea 2. Final verdict. The final score is 5-2. Coffee wins decisively for liver health. This is surprising to many people. Coffee has been wrongly demonized for decades, while green tea received all the health food glory. But the evidence is clear. Coffee provides exceptional liver protection, reduces disease progression, prevents cirrhosis, and lowers liver cancer risk more effectively than any other beverage. Green tea isn't ineffective. It offers genuine liver benefits through its catechins, particularly EGCG. It's gentler, provides broader health benefits, and works for people who can't tolerate coffee's caffeine intensity. For overall wellness beyond the liver, green tea may be the better choice. Here's the optimal strategy. Drink both. Have coffee in the morning. 2 to 4 cups provide maximum liver protection without excessive caffeine. Switch to green tea in the afternoon for additional antioxidants without disrupting sleep. This combination gives you coffee's powerful hepatoprotective effects and green tea's broader wellness benefits. For people with liver disease, chronic hepatitis, fatty liver, or cirrhosis risk, coffee should be a daily habit. It's one of the few dietary interventions with robust evidence for slowing disease progression. For general liver health maintenance, either beverage works, but coffee provides superior protection. Neither drink reverses severe liver disease or replaces medical treatment. But within a comprehensive approach, healthy diet, weight management, alcohol moderation, medication adherence, coffee and green tea offer remarkable liver support backed by extensive research. This is The Health Verdict, where nature gets tested. Stay curious, stay healthy,